Since the beginning of the pandemic, flatten the curve has been the mantra. And New Zealand has just gone one better, announcing it now has no active cases of Covid-19.
It's great to get back to a sense of normality, basically.
But it seems much of Europe, the epicentre of the pandemic in March, isn't far behind, with a dreaded second wave apparently avoided. A recent study by Imperial College London finding that early, strict European lockdowns saved over 3 million lives. But the larger picture isn't so rosy. Globally, the pandemic is getting worse. India, for one, has begun to roll back its economy-crippling lockdown, even as the number of new daily infections and deaths has increased in recent days. The US, meanwhile, which has almost 2 million confirmed cases, appears to have reached a plateau, with an average of over 20,000 new infections reported a day since the start of May. But those figures conceal the reality on the ground. States like New York that implemented early lockdowns are now seeing a drastic reduction in their number of new cases. But in at least 9 states that didn't, largely in the South and Midwest, hospitalizations are on the rise. There's no such ambiguity in Latin America, though, the latest epicenter of the virus. Brazil now has more daily deaths than any other country.
We have big cities like Rio, Sao Paulo, Lima, in where they are surrounded by a belt of poverty and inequities. So the same lockdown that was applied in Europe to a certain extent cannot be completely applied in Latin America and the Caribbean.
With virologists predicting that the peak of the virus could still be weeks away across a number of countries, the World Health Organization is warning that the biggest threat now is complacency.